After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States. Joining us now is Jenna Reinhart from Anthem Medicaid to discuss risk, symptoms, and types of breast cancer. Thanks for being with me, Jenna.
Yeah, thanks for having me.
So what are the different types of breast cancer out there?
So breast cancer is basically a mass of abnormal cells that cannot stop their own growth. These tumors can grow in a couple different places within the breast. They can grow within the lobules, they can grow within the ducts, and they can grow within the connective tissues. The most breast cancer is typically tumors within the duct and the lobules, but some people will have it in the connective tissues as well.
Yeah, what are some of the risk factors when it comes to breast cancer?
Yeah, so there are certain things that can put you at a higher risk for developing breast cancer. Some of them are lifestyle related, like eating healthy or staying active, things like maintaining a healthy weight, not being obese. Things that are out of our control are things like being a female. Males can get breast cancer. They do have a lower risk. Being taller, having a family history of breast cancer, or really any other type of cancer. Yeah, those are some of the things that can put us at a higher risk for developing.
And what are some of the signs and symptoms that one might experience when they have breast cancer?
Yeah, I feel like a lot of people are pretty well aware that any type of lump or mass is something that you should probably get looked at, because that is definitely a sign of breast cancer. But there's some things like just any type of changes within the breast, maybe like the shape or the size or even the texture, like the density, even like a warmness or redness. Sometimes the nipple will become inverted. Sometimes there can be like rippling or dimpling of the skin. So those are all things to be looking for, but really just any changes in your breast shape is something that you should get looked at.
Now, a lot of times we might see breast cancer in older women, but when is the appropriate time to get screened?
Yeah, so people can start getting screened at 40 if they choose. Maybe if they have a family history, that's something that they would want to do yearly. But they do recommend that age 45, every woman get a mammogram, which is an X-ray of the breast, at least once a year. Once you reach age 55, you can get those every 2 years. So in between ages 45, 55, you should get screened at least once a year, the mammogram, and then after 55, at least 2 times a year.
Now, if breast cancer runs in your family, do they typically sometimes screen you a little younger than 45?
Yes, and there's even some genetic testing that can be done to determine if you have the gene that puts you at a higher risk for that. But yes, a lot of times they will do, and even not all the time is it going to be a mammogram. Sometimes it could be like an ultrasound that can also be, they can screen that way.
And are there any ways to help lower your risk of getting breast cancer?
Yeah, so those lifestyle factors that I mentioned before, things within our control, just maintaining a healthy weight, eating healthy, exercising regularly, really limiting alcohol, smoking. They recommend that if you have a pregnancy, breastfeeding for a couple months can reduce your risk. So just, trying to control those factors that we can control.
All right, well, thank you so much, Jenna, for all those tips and the education about it, because breast cancer affects so many of us. So thank you so much.
Definitely, thank you.
Yeah, well, stick with us. We'll be back with more right after the break.